next topic which is I am going to deal today. You have to remember the important things. Second topic of the anatomy, general anatomy. So that is the one which is we are going to deal about the anatomic positions. So here you have to remember one which is anatomic position. One is we are going to get the normal anatomical position. Then second one we are going to get the fundamental position. These are the two positions very important in the anatomy. So what is this anatomical position and what is a fundamental position? When you see this is a human body, one which is you are going to get, and we are going to get the limbs, upper limb, lower limb, and we are going to get the lower limb. And here you are thorax, abdomen, you are going to get. So body is, we are going to study in the different planes, different positions. So this is very important to know what are the anatomical positions. In that normal anatomical position, dealing that this is the one which is a body should be in the erect position. That is a body must in the standing position, erect position we are going to get first. Second, in the anatomical position, this whatever the body is in the erect position, the eyes should look at the straight way to the horizon. Horizon means ground or the earth we call. Means whatever the eyes which are directed forwards, that is the front they are looking. Means eyes are look straight way to the horizon. Second point. Third point, whatever these upper limb which are hands, they are hanged by the trunk with the palm facing forwards. Whatever you are going to get the palm facing forwards, hands with the trunk, upper limb. Then lower limb, which is you are going to get here, they are parallel to each other. There is no any odd position which is you are going to get. It is you have to remember they are parallel to each other. With the toe, great toe facing forwards. So such condition, such body or such position we call as a normal anatomical position or the anatomical position. So anatomical position we get when body we study either in the living or in the dead, what position it is, that position we have to consider that is either in the anatomical position or fundamental position or not in the anatomical position. So that here anatomical position which is indicates the following points, that is the one which is the body should be in the erect position, standing erect. Second one you have to tell the eyes should be looking straight forwards to the horizon, horizontal, that all will be considered to the ground or the earth. Okay. So that here you have to remember about this meaning of the total normal anatomical position. So first point, body is erect position or standing position with the eyes looking straight forward to the horizon. Then you have to tell upper limbs which are hands to the trunk, both the trunk which is we are upper limb, both the right and left, hands with the trunk with the palm facing forward. Then we have the lower limb parallel to each other, great toe pointing forwards, great toe which will be pointing forwards. So you have to remember about this all we call it in an anatomical position. Then fundamental, only the palm, if palm facing towards the body or towards the midline. If it is there forwards, if it is facing towards the midline, and that is we call it a fundamental. And this is a position where remaining all is same. But this position, fundamental position, is only the change you have to, instead of palm facing forwards, it is facing to the midline. So or towards the medial side. So that will be the helping for the understanding the movements of the different terms, movements describing that time this is a plays an important role. So this is one which is you have to remember two positions, anatomical position, one which is the most important anatomical position, because any term, any words which are we are going to relate or describe, all that is which is in position considering in the patient checkup or in the organ relations, all that is we all compare the in the position of anatomy. So that is the anatomical position. So this is very important, you have to remember. Fundamental position is, as I have told, only hand palm facing to the medial side or the midline. Okay, this is the one which is you have to remember about the anatomical position. So how you are going to get in this anatomical position? Anyone can come here, I will show. Yeah. So whatever the position where he stands, you have to look straight forward and the palms totally facing both the palms parallel to each other, lower limb, straight. Okay, close pointing forward, looking straight. First what I have to do? The body is in the erect position, standing position. Looking straight, eyes looking straight to the horizon. Going to the on the long side, you have to see the horizon. Then you after that these all upper limb we call hands with the trunk, and lower limb are parallel to each other with the great toe pointing forward. So this is anatomical position. Then if you turn both the hand towards this midline, and that is a fundamental position. So this is what you have to remember, anatomical position, and your anatomical position you have to draw in diagram. Your photo and your diagram you have to draw. Okay, thank you. So next comes about the what are the planes of the anatomical planes. Not aeroplanes. We are going to not other Indian Airlines or we are going to Jet Airlines. So planes means you have to remember the different sections we are going to do. Different sections which are needed for the body study. Different positions are there, different relations study, different sections are required. That will require the different planes to study. So we get the one is median. So should not be confused with the medial. One more word which comes medial, but should not be confused with the medial and median. You should be very proper and particular in understanding the what is the median. This is the median plane we are going to get, or we can call it the mid-sagittal. Mid-sagittal plane. Then second one we are going to get that is a sagittal plane. Then third one is we are going to get the coronal plane. Then fourth one we get the horizontal plane. Then fifth one is the oblique plane. So we are dealing the what are the planes, anatomical planes we are going to get. So in this you have to remember first one which is you are going to get median plane. So what are the body which is divides two equal parts in the midline passing. When we get the body which is in the standing erect position, when we plane passes in the midline of the body, exactly midline, and it may divide into two equal halves with same equal size division making, that is we call as the median plane or mid-sagittal plane. So what is a mid-sagittal plane? It is a median plane which is passing at the center of the body and which will divide the body into two equal halves. So that will be we are going to call plane, that is a median plane. Next comes about that is a sagittal plane. any plane which is parallel to the mid-sagittal. One midline mid-sagittal it is, and parallel to this is you are going to get, that is not in the midline passing. Then it is parallel to that we are going to get the one is sagittal plane. Then coronal plane, this is also vertical plane, but it is making the right angle to the median plane. This is the one which is we get as a vertical median plane. Then coronal also vertically going this way, and that is making the right angle. So making right angle to each other, we are going to call that is the coronal plane. Okay. Then next comes about the horizontal plane. We are going to get the any plane which is horizontal to the horizon. Horizon means ground or the earth. Actual meaning of horizon is where we can see the earth and sky is meeting together. Actually they are not meeting, but one line we are going to get on the earth. That point we call as a horizon. Horizon is the meeting of the sky and earth. There is no meeting, but it appears like that is the meeting point of the ground and that is the sky. But that we include as that word horizon, that is a horizontal plane. That is the ground or the, we have the, that is the earth we call. Oblique plane, anything which is not fitting in this above and that going obliquely, which is not above, considered either not in the coronal, sagittal, mid-sagittal, that we call it an oblique plane. So this oblique plane also very important because some sections we take obliquely, and these all median plane is most important because according to that we can relations are studied and different sections we may take according to the position also we can study the body. So this is what you have to remember in the planes of the body. Anatomical planes, different anatomical planes and anatomical positions. One word here you can, according to the relates to the part, it is supination. So this is very important, supination and pronation. In this supination, when body you are going to lie down on the back and face facing forwards, above. If you lie down on your back and face is facing upward, that condition we call as supination. In the hand, supination is this, palm facing upward. This is supination of the, we have forearm and position of the hand. So here you have the pronation is the reverse, facing downward. Back is facing upward with the face facing downward. And lying down position is there, lying down. The body is lying down with the face is facing downwards. And that is we call it a pronation. In the hand, pronation is this one. This is supination and pronation. These are the two words which are commonly we use. What is the supine position and prone position? So you have to understand what is the supination and prone position, or what is the prone and supination. So both are same. They are describing the above, that is the face facing. This is the hand you are going to take. This faces upwards. So this is all which are very important in the discussion of the anatomy. These all terms, normal anatomical position is very important. Then you have to explain what are the planes which are important, which are anatomical planes. Because what is the importance of fundamental position and anatomical position. So this you have to remember about the main important point of the second topic of general anatomy. We have the anatomical position and planes, anatomical planes. So different diagrams given to understand, that you have to draw and understand. And these are the main points you have to remember in this one. Next comes about the any anatomy, general anatomy we study. We are going to study the first one, which is you have to remember, that is the one point, almost all the terms which are describing for the relations. Next topic which is we are going to get one topic which is the terms describing the relation. Means what? Anterior, posterior, superior, inferior, medial, lateral. That will be teach you. Next terms relating the movements. You have the different movements taking place in the joints. So that will be flexion, extension, medial rotation, lateral rotation, what is adduction, what is abduction, and circumduction. So these will be, we are going to deal in the terms of movements. Then I have told the terms of in relations, I have told anterior, posterior, superior, inferior, medial and lateral. Then I have told terms of movements, flexion, extension, medial rotation, lateral rotation, adduction, abduction and circumduction. So these all will be included in the terms of movement and terms of relation. Next, in the general anatomy, you are going to remember any artery, vein and capillaries we are going to study. Then other things, which is what is the difference between the artery and vein, you have studied in the 12th standard, that you have to recollect. Then afterwards we are going to study in the clinical anatomy, what are the suffix attached to the itis and all that is causing the inflammation and all. Itis, if any word in the disease we get as appendicitis, itis is there, that will give you the idea of that is the one which is a inflammation. Although we are going to get that is disease condition. So this suffix also we are going to study in the applied anatomy or a clinical anatomy. So this all will be included as a short topic, which is the terms of planes, anatomical plane, then anatomical positions. They are very important, which are commonly asked, but should not be confused with the sagittal and median plane. Mid-sagittal is different and sagittal is different. Okay, both are parallel, we are going to get, but one is in the midline passing, then one is parallel to the median plane which is passing, but both are vertical planes. Then only coronal, also this is also, don't consider it is going right angle, means it is only not in the vertical plane. This is also vertical. We are taking one section this way, other section way we are going to take, making right angle to each other, that is a coronal section. Then horizontal, you are going to get the plane which is parallel to the horizontal, that is the ground or the oblique we are going to get. This will be considered as a, which is a plane not fitting in the above, then we call it the oblique. So anatomical position I have told, and I have told that is the terms or the planes of the that is the anatomical planes. So this is a short one. You have to draw the diagrams, different position, including supination and pronation, supine position and prone position. All this can be there in the total this topic. Okay, write down.